Hello, everybody. My name is Dr. Emery Pitcel of Rothrock Chiropractic Rehabilitation here in State College. Each month, we do a podcast series called Condition of the Month. And for December of 2024, our condition of the month is carpal tunnel syndrome. Now, a lot of people are familiar with carpal tunnel syndrome being a pain that exists in the wrist, typically in the front of the hand. But what I want to do is I want to first break down exactly the anatomy that lives around the carpal tunnel and that median nerve, so that way there's a better fundamental understanding of precisely what's happening at that wrist. So for help on this, I am using Frank Netter's Atlas as the source material. And on this page here, we could see that this is, if you actually dissect it down, this would be the front of the wrist. And what we could see is we've got our association with the arteries here, but this yellow guy that's right here, this is called the median nerve. And the median nerve passes underneath what we call the flexor retinaculum, and that's the actual carpal tunnel is right down through there. And when it passes through the other side of the tunnel, it then branches off into essentially three or four divisions of nerves that then innervate and provide sensation for the thumb, the index finger, and the middle finger, and this little half portion of the ring finger. Typically, though, there's a small little nerve that actually breaks off. You could see right in this picture how there's a little bit of a nerve bundle that breaks off right before it goes into the carpal tunnel. And that is actually going to provide the sensation for the palm. So the actual classic sensation of symptoms moving into like what are the symptoms and what would you expect and start to think, oh, I probably need to go get some help for my carpal tunnel would be a numbness, burning, or a tingle sensation that is existing in those three fingers, thumb, index, middle finger, maybe part of that ring finger. Classically, though, it would actually skip the palm because of that palmar division branch that leaves off the median nerve before going through the carpal tunnel. However, it doesn't always have to follow that rule because everyone's anatomy is built a little bit different. So definitely if there's numbness, burning, tingling sensations of those three fingers, you should be thinking carpal tunnel. If your grip starts to weaken, if you're finding that, all right, everything I go to grab, I seem to have a hard time grabbing it. I'm having a hard time kneading out some bread or grabbing my phone and hanging onto it or hanging onto a tennis ball. That should cue you off that maybe it's carpal tunnel. Pain at night. So just with repositioning the hand and now the wrist isn't moving around really all night. So as a result, things kind of stiffen up through the wrist and the carpal tunnel and narrow down the space on that nerve a little bit more. So if you're getting that, it could be carpal tunnel. Symptoms that get worse with more use. So think, the more you're doing those activities of kneading out some bread, typing on the computer, clicking on the mouse, and the day progresses and the symptoms get worse in the hand and the wrist, that should cue you off that maybe it's time to come get some help and get a consult. And the last one is, yeah, and we kind of already alluded to this, hanging on to items, pain with making a fist. If you go to make that deep fist, it could be painful, or you might have the inability to do that. Should start to cue you off that maybe we're dealing with a carpal tunnel type case. Now, here's the thing. I think a lot of people hear carpal tunnel and they think I got to go talk to a hand specialist or an orthopedic surgeon. And maybe that is your first stop if the symptoms are rather severe. But a lot of these can also get better with some chiropractic care and physical therapy care first. Start conservative, then see if you get better. And if you're unable to get better, then we'll move you up the ladder and talk to the higher end specialists. So we alluded to what the symptoms are. Next, let's move into what kind of activities and ergonomic positions are likely to cause carpal tunnel to worsen or to exist in the first place. So mechanism of injury. And the number one by far is people that are using keyboard and using mouse work. Because what tends to happen then in those positions is in the keyboard, we tend to sort of have the wrist splay a little bit out to the side and also bent back a little bit. So because it's kind of up and like this and we're typing in this position, it loads up that carpal tunnel and keeps that nerve under pressure and irritation. Same thing happens with the mouse out here, kind of just with the wrist unsupported, and over time, repetition, months, years, that could start to make that area get irritated. Also, thinking of people that do heavy lifting, maybe in the gym, and aren't quite careful enough about protecting their wrists, or you maybe work like construction, or you're doing a trades type of job where you're doing a lot of drywalling and loading up the wrists a lot. All that type of manual work. And then also to throw our profession under the bus a little bit, like chiropractors using their wrists, massage therapists really using their wrist. It's not very uncommon to hear them having issues with carpal tunnel syndrome. Those that are texting, especially if we're, kind of really looking down and having the wrists maybe not quite careful in a nice neutral protected position, it can get really easy to create a problem there. Think about those that are doing knitting and crocheting, same type of deal. That repetitive use at the wrists and load can start to create problems over time. And the last one that I wanted to single out is those using power tools. So think about like the hammer swinging, really stabilizing the wrist to run in like the screwdriver or the power drill. Screwdriver especially is going to load up that wrist as you're doing the clockwise and counterclockwise turns. So those are kind of some of the top ones that we think would be candidates of if you had that going on and then you're starting to get these symptoms. It should hopefully get you into that file of the brain of thinking this could be carpal tunnel syndrome, and maybe it's time to go talk to them over at Rothrock Chiropractic and see what they could do to help. How can we help? That's always the $1,000 question. Frankly, the most important thing that most of you all probably care about. And it's really a three-pronged approach, like it is with just about every condition that we get in here. We start with rehab exercises first. So using the McKenzie method, if it is a carpal tunnel syndrome that isn't already to the level that needs a surgical consult, what we're typically going to find is that the carpal tunnel syndromes, we actually need to put some slack onto that median nerve passing through the tunnel. And so typically a traction move with some flexion is going to actually really open up that space, get tension off the nerve, and actually help people feel the best. Now, that's not a guarantee that that's the move, but when we do the assessment, that is frequently the directional preference that we discover using our McKenzie method. And then in time, there needs to be some more strength and stability that needs to be put across the hand and across the wrist. So doing things with resistance bands, doing negative intervals with light weights, actually getting somebody a little bit of like the occupational therapy putty to really actually work through that hand and those finger movements while keeping that wrist in neutral. Those are all great strengthening concepts that we tap into in times with our carpal tunnel syndromes. In the here right now, though, what we're able to do in office besides progress exercises is we do stuff with the muscle therapy. So it's really great to help the patient actually get what we call hand reposition. So opposition is when the hand narrows in close, and reposition is when the thumb goes as far away from the fingers as possible. So helping that patient to really open up that hand and wrist to get blood flow to the tissues, reset the neurological mishaps that are going on in there to get some pain relief and improve the function. A lot of wrist work as well too. So we'll usually go up and do a lot of work into like the extensor part of the wrist and work into the flexor column as well too to just further take some load off of that carpal tunnel. And being chiropractors, we like to adjust when indicated. So like I said, we typically take what we found as the McKenzie directional preference and set up an adjustment or a heavy mobilization that goes right in line with that treatment at the hand and at the wrist, helping the patient to get deeper into all of those movements. And then frequently, it's not a half bad idea to just work our way up the chain and realize the median nerve, its origin is coming from the cervical spine. So taking some time to really open up the neck, whether that's a traditional manipulation or if we decide let's do some like traction and mobilizing there. But either way, trying to remove any of the perturbations or blocks that are existing in the neck that could, even if it's just 10% of undue influence at the wrist, we want to remove that if we can. And by the same token and logic, improving the function at the upper thoracic spine should at least pay small dividends back down at the wrist. So again, the approach being rehab first, and then what we do in office that the patient can't do for themselves at home is the muscle work and the chiropractic mobilization or manipulation therapy. So thank you for joining us here in December of 2024. Once again, our condition of the month being carpal tunnel syndrome. We worked through what the anatomy is, talked about common symptoms, talked about frequent mechanisms of injuries and ergonomics that set people up for failure. And then finally, and most importantly, what's the solution? What could we do at Rothrock Chiropractic and Rehabilitation to really make a difference? So we hope that this podcast was valuable for you. If it was, please hit a like, leave a comment, subscribe to our channel, or follow us on Facebook and Instagram. But in the meantime, we hope this helps. And if you are getting anything that sounds remotely like carpal tunnel syndrome and you don't want to necessarily go directly to the surgeon, give us a shot, let us do a workup, and we'll tell you honestly if we think we could help or if it's time to be talking to the ortho or the neurologist. Thank you so much for your time. We appreciate you for watching the video. And everybody, have a great December. Happy holidays to all. Take care until next time.